I'm your host, Dr. Catherine Clinton, and I am just thrilled and honored to be here with my friend and colleague, Dr. Roseann. Dr. Roseann is serving patients all throughout the East Coast and remotely. She is a licensed professional counselor, a board certified neurofeedback provider with more than 20 years working with children's, teens, young adults, and parents across the country. She provides professional neurofeedback and biofeedback, counseling, therapy, and coaching with several different conditions. She's an expert in anxiety related disorders, ADHD, executive functioning, and so much more. Dr. Roseann serves on the boards of the Northeast Regional Biofeedback Society and Epidemic Answers and is a Lyme Connection Task Force professional advisor. So I am so honored to have you here with us, Dr. Roseann.
Well, I always love talking to you, and I certainly love talking about all things nerdy and researchy, and certainly about the brain. So this is going to be a great conversation.
It really is. And it gets down to sort of the heart of quantum biology, working on the body's coherence, the body's ability to maintain coherence through frequency, right? And I love that you are working with children and families because that's really where it's at when it comes to changing the trajectory of this chronic disease epidemic that we are in. Absolutely with our adults and even more dramatically with our children, right? We have over half of our children right now living daily with a chronic condition, not a cold or a flu or a
Right.
passing situation. These are chronic diseases that impact their daily life. So I am just so excited to dive into this and get your knowledge about what is happening with brain coherence. And let's talk a little bit about what that looks like. I know that you are using the QEEG brain map. So why don't we
Yeah.
start to explore that a little bit?
Yeah. And I love that you bring up just even the coherence within families. I mean, I talk a lot about something called share the calm. So we have 1 in 2, children in the United States who have a physical or mental health problem. And as you said, so we are worried about our kids. And so what happens in homes, I don't think parents realize we the power we can have over a kid. So yes, worry is natural for sure. And as I say, if you're driving the worry train, it's not a good idea. If you're on the worry train and you can get off, that's a better idea. But we're inadvertently have on an energetic level, but also just very much on a subconscious behavioral level, we're giving a lot of cues to our kids on how we manage stress for ourselves. And when we try to keep it together, when we talk openly about our problem solving strategies and the ways we manage things, that's how we share the calm. But ideally, we do have a regulated nervous system, and that there is a frequency coherence, particularly between a mother and a child, only because the mother is a primary caregiver most of the times. But when our caregiver's frequency is calmer, our child's frequency is calmer. And that's not to dismiss or not validate that your child is under distress, but the more we regulate, the more they regulate. So I think that is just to say that is really important because I'm always about empowering parents. I think we take away power by saying there's a pill and it's going to fix it, right? Um,
Absolutely.
and that's why I do all these therapies, like I use QEG to look at the brain's ability, how it's functioning in terms of coherence and also the structures. But I also do frequency therapies like PMF, neurofeedback has a level of frequency, and other things, including psychotherapy, and helping the body to regulate through somatic experiencing, EFT tapping. These are all ways to help us regulate our systems, and they're really effective. And that's why it's super awesome to have this conversation for sure.
Absolutely, absolutely. You're just such a wealth of information. So let's dive in. Tell us what you're seeing on these QEEG maps, these brain
Yeah,
maps that are
yeah.
looking at coherence.
Right. So first of all, brain map is how it's done and what it is. So it's a way to get a visual representation of the health of the brain. We can see brain wave activity, which is called EEG. And an EEG is different than a QEG. QEG is looking at patterns, where EEG is actually looking at raw brainwave activity for a different purpose, for medical purposes. Is you've had concerns about, there could be a seizure or some other anomaly in the brainwave functioning, you would do that typically in a neurologist's office. That's where that's done. But QEG is really to look at what is happening in the different structures, what's going on in the frontal lobes, what's going on in your emotional center, your limbic, system. And is it overworking and is it underworking? And that's really the most simplistic way. But what most people don't know about a QEG is it looks at how the brain is communicating to itself. And the brain talks to itself. And the way that I try to get people to think about the unbelievable power of brain communication is that when your brain is communicating really smoothly and at a high level and is efficient, it's like getting onto the highway at a Sunday morning and there's no traffic. And you get on there and you can just zip on or whatever. When you have issues with how your brain is communicating, and we can dive into why there are issues and what it looks like, it's congested. You're in a traffic jam. And for many people, you're using Waze. You can't even use the highway. It's got to send you in the back road. And that's because the communication can be hyper. It can be over communicating. You can be in a stuck, stressed rev state, typically sympathetic dominant, right? So our nervous system can either be stressed in the sympathetic dominant or relaxed in a parasympathetic. It also can be sort of worn out. Communication systems can get very, very, very worn out. And the brain, there's a cortical timing, like the way that the brain works very much is in sync to its environment, right? Our brain and body pick up those, just like picks up a stressed mama, a kid picking that up. And even when we think we're holding it together, usually our kids, if you're properly attached to your child, they will pick up on cues even more, right?
Yep.
And we want our kids to pick up on cues because we're here to teach them and show them all the different ranges of emotions, not just happy, but sad and irritated and surprised. There's all kinds of emotions, and they should do that. But a QEG tells me what area is working, what area is not, and how is the brain communicating. And they're equally important. And I would even say the brain communication centers and coherence in the brain is probably trumps everything. And I'm just seeing so many brains in a rev state. I mean, we're talking all ages, Catherine, like, little kids to older individuals. It's very easy with life's compounded stressors and also our disconnect from grounding and from purposeful moments of quiet is causing our nervous systems to overactivate.
Yes, absolutely. Absolutely. And I love what you say about the ability to co-regulate. My youngest, when I get stressed and I'm trying to keep it
Yeah.
together, one of my eyebrows apparently kinks, and so my youngest, I'll say, I'm fine. She says, wait, but your eyebrows, you're not, so it's this really fine-tuned ability to match frequencies, right?
Absolutely.
That's what we're talking about when we're talking about the ability uh, to communicate via coherence, is that matching of frequencies.
And
But
what I say to parents too, or individuals is like, if you can think about somebody in your life that is incredibly anxious, you literally, their anxiety is palatable. You can feel it coming off of them, right? Or somebody with extremes in mood, right? You can feel it. It's the same thing. So we can change that. We can flip that script and we can have regulated coherencies and frequencies that we can share. I love when I'm with high frequency individuals, which are my peeps, my friends. It is like almost like a vibrational lift that comes out with it. And I'm super grateful. My parents always made me honor my discomfort around people that didn't make me feel right. That's frequency. And they would never make me, hug and kiss somebody that I didn't like, which is very unusual in the Italian culture. And they were like, nope, doesn't feel right. That's okay. You don't have to do that. So it's very empowering too. Just as a side note of empowering your kids to
Hmm.
honor what comes through for them, because that is frequency as well.
Oh, absolutely. Absolutely. And it's so important that we are empowering our children to listen to that. Because how many of us have entered into our adult life with those intuitive signals that we stuff down and continue,
Totally.
you know, absolutely. And it's never good. It's never good.
Never good.
No, no.
Mm-mm.
Well, I absolutely love this because, those Penrose did a bunch of studies with microtubules in the neurons of the brain, showing that electromagnetic wave of information, of communication, is really driving that coherence within the brain. And so I think what you're doing is absolutely amazing. And I'd love to hear about how you are approaching a discoherent brain.
Yeah. Yeah. So first of all, I mean, I have a program, it's called Brain Behavior Reset. And why it's called that is that we have to calm the brain, right? And then we have to reteach behaviors, because it's not just about calming the brain, it's about changing your behaviors, right? And we all have behaviors. Sometimes habits can be good and habits can be bad. They can not serve us, as I like to think of. And so when I talk about teaching the brain and body to regulate, right? Because I don't really separate the two. There's always a distinct, right? Who do you ever see that is anxious that doesn't have a physical ramification, gastrointestinal, chest pain, regardless of age? And it's like that in all I specialize in PANS and PANDAS and OCD, and you can just see physically the struggle within them. So when I do a QEG, it really gives me a chance to, what I like to say, check under the hood and really say, this is what's going on. This is a dysregulated brain state, and this is how that dysregulation is showing up. So when the brain is dysregulated out of coherence, you're going to see problems. You're going to see focus problems, anxiety, gastrointestinal pain. I mean, just a variety of things depending on where it is in the brain, right? Because brain can only do certain things, you know. Your frontal lobes gets involved in everywhere in the brain, but it's not the encoder of emotional information, but it helps with it, right? But our limbic system, is our first sign of first part of the emotional encoding part of the brain that starts a cascade of, is this dangerous? Is this not? It helps you interpret things. So what I do is a culmination of things, right? So obviously we want to take that full, 360 approach and really look at what's going on. There is no magic wand. And what I try to do is regulate the brain with science-backed tools first. So we do things like biofeedback, PMF, and neurofeedback. I love them. Why do I love them? People come to me are really distressed. Sometimes I get people who are just a little bit and they want to be proactive, but that's not my norm. My norm is dealing with individuals that are really stuck. They're having an incredibly hard time. And that's okay. Right. So I never worry about what the problem is, as long as we have an attitude that we're ready to get to change and that we're ready to do work, and that Dr. Rowe isn't Jesus. We're good. And we're nice. Everybody's got to be in alignment. Then we welcome everybody. The issue never really is ever a deterrent. It's like, well, how much are we ready to get in there? Like, get into that and clean it up, because there's always a way, and science shows us. So I love to calm the brain first with those tools, but also layer in if somebody is able to make subtle changes in their diet, right? Particularly when a brain is in a rev state, you need a lot more fat. You need more consistent protein, more than anything. Those Cheetos aren't going to help you.
Right. Absolutely. Absolutely.
And then really work on some of those components that really hold people back. I mean, for me, every parents always say, like, does this work? I'm doing your program and it's a lot. It's hard. And I'm like, okay, hold on. I'm going to tell you the number one reason why this doesn't work. Number one, it's you. They're like, what do you mean? I'm like, it's the parents. Like, you get on the worry train, you give a push and pull, you don't see it working, you don't make the micro steps. So it's hope and belief and visualization. So we work a lot on that. When you talk about energy fields, right? And in quantum physics, like, it's not that you're like, if you have ability to really impact your whole environment about how you interact with it. So if you're stuck in a negative framework, which guess what? Many adults are, it's very, very normal for you to have happen, but you're going to have to unlearn those behaviors. And it's not going to happen overnight. It's going to be really work conscientiously to unravel that. And you want to do that because who hates being a negative thinker and a catastrophizer? Of course, everybody hates that. You know what I mean? It's terrible, but you have to really get into some of those things. And that's how I work. And that's why we do a program where people have to do, a prescription. Certainly, again, I love neurofeedback. I love PMF. It really gets to change quicker in a way that's more comfortable for people who are, having a mood issue or OCD or even physical discomfort. It's very hard when you have something holding you back from being your best self, or to watch your child go through that. To me, is even harder.
Absolutely.
Yeah.
Absolutely. I would agree. I would agree. So take us through what's happening when you are using PMF or neurofeedback
Yeah.
with the brain and with the coherence and the ability to communicate between different parts. What's happening there?
Yeah. So we start with either a QEG or a brain check if people are fully remote and can't get here. And basically, we're collecting data points to see what is actually going on. We don't do any guesswork here. We're like, what is going on in the brain? What can the brain do? What can it not do? Number one. Okay. So mental health is like whack-a-mole, is really what they decide. And then with neurofeedback, let's talk about that. So people may have heard of neurofeedback, but they don't really know what it is. So neurofeedback is, we're using technology to reinforce the brain to produce a healthy combination. So I predetermined, oh, I want the frontal lobes to work better. Oh, really, I always do brain coherence. Like, I always get the brain to communicate better, because it impacts the entire brain. It's not just one region. And there is a softening for an anxious person or a rigid person. There's a softening that happens with them. And a perfect example of that is somebody on the spectrum. I'm like, you're going to get a softer person. Okay. And most people are doing 2 or 3 sessions a week. They're about a half an hour, for about 6 months. So people are doing 40, 50 sessions, depending on what's going on. And you have to unlearn. You have to unlearn. It's a process. It's very pleasant, and you get reinforced to produce a healthy combination. And what we do is EEG neurofeedback. So it's a visual image, auditory sounds, and the brain, 2 to 3 seconds, Katie, produces a healthy combination. But it doesn't stay there. Just like the one time at the gym doesn't build you the muscle, you really got to do it over time. And what I'm really doing is trying to get in a state of a hyper coherence where it's over communicating, too much activity, regulate, low activity, like, for example, somebody with a learning disability or attention problems, their brain just might not get the job done faster. So when parents are like, oh, I've asked him 7 times to do that. Well, it's because his coherence is low, right? And so the brain gets reinforced. what you see is changes in intensity, frequency, and duration of behaviors and difficulties, and a gradual improvement over time. There's tens of thousands of research studies, 3,000 peer-reviewed. In so many areas, it's hard to list, but a lot of mental health issues. And the research also says that the changes are sustained over time, and they have research as far as 10 years out to demonstrate that, which is pretty awesome.
Amazing.
Yeah,
That's absolutely amazing.
yeah,
Have you ever had someone come in thinking that they had a brain issue and your maps showed something else?
pretty much every day. Like, I mean, two of the I mean, most people think they have ADD, right? So, and one of my most popular blogs is like, 10 things it could be besides ADD, right? So people will come in and say, I'm having a hard time focusing, and we do a brain map and we look at all the reasons it could be. And a lot of times I would say less than 50% of the time, it is ADD. So it
Wow.
could be a birth trauma, it could be anxiety or a mood disorder, a lot of times a learning disability like dyslexia or a math problem, some other area. And some people just have um issues with, in the area of executive functioning without being ADD. And also some people have very poor coherence. So the structures might be working, but if this area A and area B are awesome, but they can't actually, there's no bridge between the two, there's lots of problems. Like, you need that fluidity. If you think of yourself like, I'm an awesome multitasker, okay? I have 67 tabs open at all time in my brain.
Me too.
I don't recommend this, but I mean, I do a lot of PMF. That's my main thing I do now. I've done hundreds of sessions of neurofeedback. It's why I can write books like nothing, like just bang a book out. And I love to write, and it's an outpouring of what's there. But the brain, you need to calm your nervous system down too, and you need it to regulate. But it's very common for somebody to come in and think it's anxiety or it's some other component, and it really is something else. And it's part of why, I mean, most people that are coming to me, and I think this is pretty standard, most people don't have a mental health issue and then just get better after seeing one person. You're seeing multiple providers. I would say that my people are seeing 5, 6, 7, a dozen, 20, or more. If I have anybody with infectious disease, which I have a lot of people with infectious disease induced mental health problems, they've pretty much seen 20 or more providers by the time they get to me. If they're over age, 12 or 15, somewhere in there, tweenie to young teen, it's that bad out there. And people really, really struggle. So what's great is by getting the root cause, we're able to get the right treatment. And it's not just the right treatment, it's the right treatment in the right order, right?
Right.
So a lot of my clients and most people have complex issues. You don't really have, oh, he's a sweet little guy with just a smidge of ADD. Just a smidge. Usually he's got eczema and he's got a gastrointestinal, and he's having a hard time getting along with friends too. So you're kind of like, what's going on? So, but that happens a lot. That's why I'm a huge fan of supplements. They really, nutrition is always the best. But when we have genetic mutations and deficiencies, and also too, when systems are off, like entire family systems are off, and there is a frequency within the family of stress, it is very hard for everybody to find a regulation unless they're all working on it together. Right.
Mhm.
And that's why a lot of times when we work with one part of the family and this one part gets better, another issue can rise. And we talk about that preventively because we want people to do these things together, right? So making dietary changes together to the best you can, Not saying it's perfect. You don't have to be the Hodge and Dr. Katie level. Um, if you want to, we'll talk about it with you. But no pressure. But maybe it's just swap outs for now of, for junk food, healthy alternatives. Maybe that one thing is where you need to start. And it really has a synergistic effect within a family.
Absolutely, absolutely. I love that you bring the frequency of the family into it because it's so important and it's so overlooked in mainstream medicine. I mean,
So overlooked.
yeah,
Yeah.
it's
Yeah. If you're
absolutely,
going to a therapist and they're only treating your child and they're not working with you as a family, the issue is it's only being band-aided. And it doesn't mean you're a bad parent. It doesn't mean any of that. It means that there's a system and there are parts that all have to work together. That's it.
yeah, absolutely. It's that coherence. It's just
Right.
getting that, matching those frequencies and getting that frequency right.
That's
Yeah,
right.
absolutely. Tell us just a little bit more about your PMF and
Yeah.
how you're
Oh, so
using it.
PMF, we didn't get into that. So PMF stands for pulse electromagnetic frequency. Now, these are healthy frequencies. They're not the EMFs
Right,
that
not,
people hear about.
yeah,
Yeah.
yeah,
So I use a device that we're actually coming out with our own product line. And what's going to happen is we're making PMF specifically for different mental health issues. So there'll be one PMF device for anxiety, another for mood issues, another for autism, and so on. So we'll have a line because we program our current devices now, and we wanted to make it easier for people and also more accessible where we can do it, and it goes through the different areas. But what is PMF? So PMF is frequency medicine, essentially, where we know the frequencies of everything, right? As people don't realize it, like we know the frequency of a strawberry, people.
yeah,
Like we know the frequency of viruses too.
yeah. They
So
all have
this
their own
device,
EMF signature.
yeah, right.
Absolutely.
They do. So PMF and this device that we use, we are using the known frequencies for these specific conditions. So for example, PANS and PANDAS, I've got the frequencies of parasites in there and viruses and all the things that are the most common things, because most people have a lot. And this device sends a signal to the cell, disrupts cellular communication, then comes in with a corrective communication so that the cells can start working correctly, which is so cool. Then what it does is it calms you from a stressed sympathetic to a relaxed parasympathetic state. And then the third thing it does is it PMF improves detoxification, which is going to lower inflammation. So these three components are very much issues in mental health that it directly addresses. PMF feels really calming. I would say maybe 2 to 3% of people don't feel an immediate calming effect from PMF. It's why I crave it, because I'm a spaz, and it helps me to calm down. I do it at night. I do it every night. And I, with our device, like sometimes I do the sleep one, sometimes I do inflammation, sometimes I do infection. Like it all depends on what's kind of going on. Like yesterday, I had a COVID exposure. So I made sure I ran myself on the infection. I ran myself on all the ones that I thought that I have that have helped me in the past with my exposures. And as we've all had quite a few exposures, at this point. So it's a great device. It's easy to use. The device I have, what we're going to use is very portable. So you can put it in your pocket. You don't have to sit on a pad. So you can put a pad on it if you want, but what we found is none of our clients were using the pad. So I just put it in my pocket and I go to bed with it. That's what I do. And it makes my life easier. You hit a button and it's programmed and it's good to go. So it's really designed to improve cellular communication and change frequencies from unhealthy frequencies to healthy frequencies. And it's got about 30 years of research, PMF, to show that it can be helpful with a lot of things, a lot to do with chronic pain, improving detoxification. I know my quality of life is much, much better. I used to go to acupuncture for about 20 years. And the day I got this, and our product is developed along meridians as well. The day that I got this was the last time that I went. I didn't need to go anymore. Like it's
Amazing.
pretty cool. Yeah.
That's so amazing. And
Yeah.
I love PMF and I love that it is working. I talk a lot about structured water and how it lines our cells and is the source of that trapping and storing of information that we get from a device like PMF. And so I absolutely love that you are getting to the root cause of this cellular decoherence, the inability to communicate and
And
coming
so
in.
many things are impacting our cellular communication. And I don't think people think like that. They think, oh, I have anxiety, it's got to be a neurotransmitter issue. I rarely find that to be the case. I'm not saying neurotransmitters aren't impacted. I mean, these devices and technologies and lifestyle changes, exercise, improving our gut microbiome, they all impact neurotransmitters in a way that's safe, effective, and most importantly, research tested. When it comes to children, 70% of the time, medications are used off label. And that means there's no research. And yet people feel more comfortable putting their kid on a Ritalin or, an SSRI when, the data just doesn't substantiate the efficacy, at least in the long term, for sure. Even with Ritalin, we know that after, ADD meds, that after 3 years, you no longer can tell the difference between a non-medicated and a medicated child. So it's just not working for a lot of reasons. It destroys the gut microbiome. You usually start food restricting, so you're not getting nutrients. But we need to, this is why these conversations are important, because we are in a total mental health crisis. I mean, in these 30 years I've been working, I have never, ever, ever seen parents and kids more distressed than I do now.
Mhm.
And there's sort of an acceptance of it, which is even more bothersome to me.
Mhm.
Because for me, I'm a solutions girl. You have an issue, what's the solution? Yet people are sort of like, well, just binge watch Netflix, I'll drink 3 to 6 glasses of alcohol a night, I'll do things that sort of numb my body, when there are many ways to change that, and I think we need to look at what are the little ways,
Yeah.
right? And
Mhm.
that's what I like about frequency, because there are so many ways that we can change our biology. And our biology does not define us, but yet there's so much science out there to show us how to actually do that. And it can be done in such an organic way that feels in alignment with yourself and your family life.
Absolutely, absolutely. Dr. Rowe, thank you so much for coming on here and just taking us through the steps of what you are doing, how frequency can be used to bring coherence to the brain. And I totally agree with you. I mean, we are at an all-time high with mental health, with physical health.
Yeah.
The last couple years have been absolutely like nothing we've ever seen in the medical community. So I'm so glad that you could join us today. You are
I feel
just
grateful and honored to be here. I'm so excited. I'm always excited about your work, and you're getting people to think differently, and opening the door, which is why people really embrace everything that you do.
well, thank you so much. You are just an absolute gem.